NHS Lothian's primary goal and objective is to maintain and improve the health of the population of the area that we look after. The IT function primarily plays into the vision of the organisation by trying to remove the geographical boundaries that we are dealing with.
Some of the objectives of the eHealth department are around improving efficiency, improving patient care, improving quality of information. So it's very much about providing better clinical information, better clinical care, and the systems around delivering care. We've significantly changed the IT landscape. Serious changes in terms of the deployment of IT, the use of IT, and making much more of an impact to patient care, delivering the right information in the right place at the right time.
Northgate would be my kind of first port of call when we've got any challenges or we require assistance from one of our vendor communities. We work with a number of partners on a range of things, but that overarching umbrella for us would be Northgate.
We very much believe that working in partnership is key to a successful relationship. We very much have that, a very strong partnership with Northgate. We've had such projects as the clinical portal, very different project for us in terms of it's quite technical, very innovative in terms of what it delivers, and of significant benefit to the clinicians at the front line.
At the bedside you can get everything you want. You can look at x-rays, you can show patients x-rays. If a result's come off the lab 2 minutes ago, you'll have it at the bedside.
The real benefits for us on thin client computing are about giving clinicians access to data in a timely manner. It's electronic, it's available, and once it's available electronically, it really is available for clinicians anywhere. So it doesn't matter which site they're at, where the data resides, because we can give them access to that data wherever they are in the format that they want.
You can access the information that you're requiring a lot quicker. So it is maximising the time that we do have with patients.
So single sign-on is a terrific way that you remember one password that gets you into the main system when you start your day, and after that every application you open that you use routinely, it remembers your sign-on, and as you have to change your passwords, which you do, it remembers that, so you don't need to keep remembering half a dozen passwords.
The headline items for me have been the introduction of unified comms to allow a much more efficient and effective range of communication channels for our staff.
I find Communicator is a wonderful tool. The feedback from the trainees is very positive because it saves them a lot of time. They can stay within their own workplace and they are learning on a one-to-one basis, and a one-to-one basis is the highest quality of training that we could ever possibly provide to our members of staff.
It was probably one of the fastest return of investments within IT that I've ever seen. Straightforward arithmetical calculations on that one just seemed too good to be true. And we sought to introduce 3,500 units, targeting staff to reduce their travel by a mere 75 miles a month, and that would give us a real saving just on travel costs without taking salaries into account of just shy of 1.4 million a year, and reduce our carbon impact by a staggering 3.2 million miles a year.
The speech recognition software that we're using, we've used in our department for 2 to 3 years now, and it's really revolutionised our day-to-day office work.
That's allowing the clinicians to work much more efficiently, freeing up the time so they can spend much more time with the patients.
It looked to us to be an ideal solution to provide us some governance and some controls around data leakage, and that was one area where Northgate brought us something that was completely new.
We're starting on document scanning. So again, we're working with Northgate in terms of scanning all of our records, putting that into a store where all of the metadata is attached with the document so that clinicians can find that with the appropriate context. We see that as a major improvement in terms of healthcare. We have 36 kilometres of shelving with notes on. So the fact that that will be made available electronically makes it much easier to deliver it, again, at the right time, in the right place, in the right format.
Northgate's general approach is very much one of listening initially, taking on board what we feel our needs and our requirements are, and then coming back with a range of options. Thereafter, the focus becomes one on delivery, and Northgate are experienced with working with public sector and particularly NHS. We have introduced within Lothian a number of radical changes and developments over the last couple of years. Our immediate future is one of taking a chance to consolidate on those, to implement them across the entire organisation rather than just major components that we have just now. I've always found Northgate to be very responsive, to treat me as an individual and as our organisation as a customer rather than a source of income. That has been a relationship that's been ongoing and that just continues to grow and flourish.